Good morning, everyone. We'd like to welcome you to today's wellness webinar brought to you by ZYTO. We're glad that those that are attending live could be here with us. We hope that you're having a good day so far and that we can add an awesome webinar for you. There's going to be a lot of awesome information today from our good friend, Dr. Bill Lawler, who's joining us today for this webinar series. Today, I can't even believe it. When I came into work this morning, it's like August 1st. I can't believe the summer's already hit August, but we've had a busy month here at ZYTO, a lot going on, and we've been all over the world doing a lot of really cool things, meeting a lot of really great customers, and sharing the technology and the value of what our technology can bring into holistic practices and building businesses and really providing additional information for people to then take that information and derive additional health benefits from that. So my name is Jeff Crabb. I'm the Director of Marketing here at ZYTO. I've hosted several of these in the past. I know our last one was hosted by Sarah. She did a great job, and I'm glad to be back. I've missed being around. But I'm sure you're going to see other faces here at ZYTO here in the future, so hosting this event. So ZYTO, if you're new to ZYTO or haven't heard of ZYTO before, ZYTO is a health and wellness technology that harnesses the value of galvanic skin response utilizing what we call our hand cradle right here. And the hand cradle actually measures the skin conductivity and allows us to then provide additional information and data points to health practitioners all around the world to help individuals find ways to improve their overall wellness. And it's not a diagnostic tool, it's not anything to cure or treat, but rather an information resource that then can provide practitioners or business builders alike opportunities for recommendations and things. So we're excited for today's webinar. Dr. Bill Lawler is obviously a great resource that we have here today. He has years and years of experience in dealing with, he's obviously a doctor of chiropractic, but he works with children. He's obtained his pediatric certification through the International Chiropractic Pediatric Association, and his specialty is with children, families, and pregnant women. And then he, as you can see, obviously over 30 years of experience. His website is right there, www.mychiro4kids.com. And so there's obviously a lot of good resources and things on his website that we'd encourage you to visit during and after this presentation. If you're seeing this after on YouTube, we'd obviously encourage you to visit his website as well. So we are really glad. It's funny, we've had 6, I believe, of these webinars so far this year. We've had hosts from all around the world. We've had people here in our studio, and Dr. Bill actually comes to us from Utah, right here up the street from us, not too far. And it's kind of been funny because we've run into some technical prep stuff that's been more challenging for us, and it's ironic that technology just seems to be that way sometimes. And so, regardless of the distance or things like that, but we're glad that we finally have good connection with him and that he's here with us today. Without holding it up too much longer, I'm going to hand it over to you, Dr. Lawler.
Awesome. Well, it's good to be here with you, and it was nice talking to Jeff to get this set up, and Lindsay's been a big help at ZYTO as well. I just got introduced to the ZYTO world. Actually, a few months ago, I've met a few of the directors of your company, and I got my first little hand cradle 2 days ago, and little Evox thing I put my hand on, and I haven't had much time to use it because I've been so busy since, but I'm very excited about the technology. I love anything that can help the body heal itself and work on itself, and I think the technology that ZYTO has is awesome. So I'm very excited about that, introducing it to my own life and then to my practice as well.
Yeah, it's awesome. We're excited for you to learn. I think you've been introduced to ZYTO Evox, is that right?
Yes.
Okay.
I don't know how many products you have, but the Evox is the one that sort of caught my attention, and I really like the concept of what that one does. The title of what we're going to talk about today is Raising Healthy Children Holistically or Without Drugs. Just to give you a little bit of an idea of why that's a topic. For me, I have 6 kids. My wife and I have 6 children. They're all adults now, because the next line would imply that we have 12 grandchildren. And I began chiropractic school before we started to have children. So I actually was already immersed in a holistic environment, so that when decisions came up about, including very early on, vaccinations or medications, antibiotics, all that, I was already immersed in this world of, there's probably a better way to do this. If you can listen to your body and do things holistically, that's a better approach. So that's how we raised our kids. Out of our 6 kids, and I did the math once, and I forgot what the number was, but if you take 18 years of being sort of responsible for your kid times 6, that's a number. 6 times 20 would be 120. So it's about 100 years worth of being responsible for kids. We only used an antibiotic one time for one child who got a waterborne parasite from a lake. But other than that, any other thing that came up, any other malady, fever, throwing up, diarrhea, any other thing, we chose to treat naturally, and the body responded. So that's my, other than the fact I have been a chiropractor for 36 years, but I think it gets more emotional when it's your own child, and when you have to make a decision at 2 a.m. or at 10 at night, and Susie has a fever, whatever else is going on, you have to say, okay, what am I going to do to help my child right now? And my whole presentation is going to be on just the fact that I am a firm believer that we're born to be healthy. I'm going to dance carefully around. I'm not going to slam Western medicine. I'm not going to say bad things about it, but there's a different philosophy. We're going to get into that. And I believe that, yes, those are other seminars that I do talking about nutrition, about vaccination and trigger points. So let's dive in right here. Western medicine basically is very involved in our whole society. I don't know if there are people listening internationally, but in the United States anyway, we are bombarded by advertisements on TV, in magazines, in newspapers, certainly online, that the way to take care of XYZ problem is to take ABC drug. So it's as simple as, if you have an upset stomach, that there's a pink colored thing that you can take. There's antacid tablets you can take. There's all these remedies, over the counter or prescription medication, that's what you should do for that symptom. Eastern medicine, on the other hand, or looking at things holistically, is more, okay, what's going on? Why does Susie have the fever? Why is Jimmy throwing up? Why does George have diarrhea? And so forth. So you're asking more of a why question than you are what, just a what. Oh, this is a symptom. I need to get rid of the symptom. I need to jump in and do something about this. So it's a whole philosophy thing. We're going to talk about the difference. It's sort of mechanistic thinking is Western medicine. Eastern medicine is more about the flow of chi, the flow of energy in the body. So here's some examples. In fact, if you're too hot, if you have a fever, Western medicine said, well, that's obviously something bad. We need to cool that down. We need to treat that. So let's talk about a fever for a second, for a few minutes. Why does somebody get a fever? Well, 95% of the time, it's because the body is trying to fight something. If you're out camping and you want to purify water and you don't have a tablet to do that, you don't have a filter to do that, your other option would be to boil it. So you actually boil the water. It boils and gets rid of the impurities, and it's okay for you to then consume, drink using your food prep or whatever. The body has this innate wisdom and intelligence that says, right now we need to give Jeff a fever. We need to give Bill a fever. We need to give somebody a fever because we got to get rid of some bad stuff in here. There's a bacteria, there's stuff going on. And so the innate wisdom is saying we need to raise the temperature. If you then say, no, we don't want to do that. We don't want to make them uncomfortable, and you reduce it, then you're actually compromising what the body's trying to do. Blood pressure is a tricky subject. That's the next thing. If it's too high, I would always ask, is there a natural way to reduce it instead of taking things that are pretty nasty, like statin drugs have a pretty bad rap because they have a lot of side effects, and they work on cholesterol and blood pressure, stomach acidity. I actually suffered from that before I got into chiropractic. I always had just sort of this heartburn thing going on. And Western medicine would say, okay, well, let's take an antacid. Let's get rid of that acid. It wouldn't ask, why does that person have acid in the stomach? And in my case, just a little, we're going to talk about chiropractic a little more later, but when I got my first adjustment on my spine, I had no pain in my back, but the area of the spine that's connected directly to the stomach was in fact misaligned or subluxated. When that was improved, then all of a sudden my brain and my stomach talked to each other better, and my heartburn went away. So I had been taking lots of antacid tablets, but that wasn't the cure. That was just treating the symptom. If you have a headache, rather than just taking a painkiller, I would ask us all to say, okay, why have I got a headache? Did I get too much sun? Have I not had enough water? Have I stressed out of my mind? Did I not get enough sleep? Ask questions of why the headache could be there instead of just saying, well, obviously I need to take some kind of a pill to get rid of the headache. If you have too much energy, this is a tricky subject, ADHD. Do you then stimulate it? I didn't understand before. Ritalin and Adderall actually stimulate your body even more to get you to calm down. So I think that's a tough sort of option. But some people, I'm not telling anybody what they can and can't do. I'm just saying, if you have too much energy, is there a way to help that without doing a drug? Not happy enough. I know that an interesting thing, the state of Utah actually is very, very high in taking things like Prozac and things that help to sort of chill people out. And I would be an advocate of, why don't we find a way to chill out without the medication? Why don't we do something that we could, maybe we need to go camping. Maybe we need to get out in nature. We do live in the state of Utah, and the mountains are awesome and beautiful, and there's lots of hikes you can go on. And I think that's worth way more than medications to do that. And a virus and bacteria, that's back to the antibiotic thing. I'm not anti-antibiotics. I am anti too much use of antibiotics. And I'll tell you a quick story. I had a boy, 2 years old, came into my office when I was practicing in Maine. I'm actually from the state of Maine, which is also a beautiful place. Anyway, this boy comes in. He's 2 years old. I've known the mother for a while. She came in during her pregnancy. Little Sam has had ear infections and sinus congestion for his entire 2 years of existence. So he did round 1 of antibiotics, wasn't strong enough. They go to round 2 of antibiotics, a little stronger, still didn't help. They were contemplating going to round 3 or to going to steroids. And the mother's name was Linda. And she said, I thought I remembered you said something that maybe there's a natural way to help someone with an ear infection, with sinus congestion, et cetera. I'd rather do that than give my son steroids. And then they want to put tubes in his ears if that doesn't work. So I said, absolutely, let's see what we can do to help Sam. So he comes in. He's very congested here. I do a natural, it's not just my thing, but a lot of people, to drain the sinuses is a natural treatment. To do that either a practitioner can do. I teach parents how to do that, get that to drain. There were some issues in his neck that were misalignment subluxations that probably started at birth. Birth is a very traumatic experience for everybody, particularly for the baby. We did a little something there, encouraged him to get off of dairy while he was congested, and did a few other things, get increased fluids. And sure enough, within less than a month's time, Sam, for the first time in his life, has no ear infections, has no sinus congestion, and his body did the healing. I did a little bit of an assistance. I gave it a little help, but then the body did the healing. And that was without antibiotics, and it was in a natural way that the body could, in fact, heal itself.
It's so funny. It's so funny to me because, you see, and I'm sure everyone watching can relate to this, but sometimes you're watching TV and these commercials come on for these drugs and things like that, and they talk about the benefit of the drug for the first 10 seconds of the commercial, and then they spend the next 20 seconds talking about all the risks and things like that could potentially come along with it. It's like, wow, you're really accepting of all these risks that potentially could harm or inhibit your body's ability to heal itself.
Excellent point. In fact, even the over-counter stuff, I think everybody, and I see there's a bunch of people listening, and I'm just guessing that we already know if you take a lot of painkillers, it's going to have a nasty effect on your gut. It affects the stomach. It affects your kidneys. It can affect your liver and spleen. And so that's just the over-the-counter stuff. And you're absolutely right, Jeff. My wife and I sort of laugh in a sad way when, and the one that I just remembered, it doesn't matter that I remember the name of the drug, but it was for acne. And sure enough, it said, acne can help, da-da-da. But then the side effects were like, oh my gosh, it was just terrible. I think all of them seem to include death somewhere in there.
I know, right?
I'd rather have some zits than the death thing, or that my kidneys get ruined. And we tend to accept that a lot more. Another quick story, had a good friend of mine who had Crohn's disease, which is a no mess around, very serious, very painful, and it's a lifelong affliction. And she'd been dealing with it and done a variety of things, had done some surgeries that helped because they actually remove this ulcerated part of the intestines, pretty rough and pretty gross. Anyway, all of a sudden she has all these new symptoms, just totally kicking her butt, and she feels terrible. She goes to the hospital, and finally she said, I'd like to know more about this drug, this new drug that I'm taking. And the PDR, physician's desk reference, every one of her symptoms were on the new drug. So she immediately said to the doctor, look, we got to find something else because this is giving me all this new stuff that I don't need. Let's find something else we can do. So I'm not saying that medicine is never a good time. It's not ever something to take because that's a decision you have to make. A slide we'll get to later talks about the decision process. But we definitely way over medicate. The United States is way at the top of the list per capita of people taking both over-the-counter and prescription drugs. And then if you look at our ranking worldwide, we're somewhere between the 40th to 50th slot as far as health. So we're chasing, it's kind of the dog chasing the tail. We're going the wrong direction to find something that's within our body in the first place. Okay, so this kind of encapsulates it. I love this book, Healing in the Mind by Bill Moyers. He talks about going into a Chinese, in China, going into a Chinese establishment where they had option to go, I don't know if it's the right or the left, doesn't matter, but one side of the facility was Western medicine treatment. The other side of the facility was Eastern medicine treatment. And I just thought that was pretty cool. I would like that. I'd like that here in the United States. I'd like to be able to go into a place and say, okay, why don't you tell me what are my options here? If I have XYZ symptom, this is going on, what would you do Western medicine-wise versus what would you do Eastern medicine-wise? And sometimes I have had surgeries. I had a knee surgery, I had a finger surgery. I had horrible impacted teeth that were never going to go away. And so I did do those surgeries. And that was something that I needed to do at that time. So I waited out and said, yep, Eastern medicine is not doing enough, so I need to do that. But for the rest of my 60 years of life, I very rarely have done Western medicine things if the Eastern work. So just to look at this, it kind of talks about Western doctors look at chemical imbalances, abnormalities, whereas Chinese doctors look at the qi in the body, the flow in the body. How can we help the body function at its optimal level? And I just think that that's the way to go. I mean, like I said, I've been doing this 36 years. I am a dad. I'm a grandpa. I've talked to people for all these years, and I just find that so many, huge percentage of the time, that the body knows the answer if we can get in it. That's why the ZYTO thing, I'm not doing a shameless plug for that, but that's what was intriguing to me about the machine is if you can tell my brain how to work better, if you can tell me what natural supplements I need, what essential oils I need, and I help the body in a little teeny way, as opposed to getting out the shotgun and blasting me. I mean, that just makes so much sense to me. Another story comes to mind. I did have on my hand, and my hands are very important to me because I'm a chiropractor. So I had this open sore on my hand that just came out of nowhere. And I tried natural things I could think of, salves and creams and whatever. I went to a Western medicine doctor friend who was a dermatologist, and he said, yeah, you can use a steroid and whatever. And I said, okay, I don't really like that idea, but I did it for a little while. And then I had a friend who was a homeopathic doctor, and I went to him, and he did this long hour interview of what's going on in your life and all this stuff, asked me about my relationship with my wife, and she was there with me, so I had to say that it was great. It was, and I didn't have problems with that. Did I have stress in my life? Of course I did. And we talked about some of them, and he, after all this interview, he says, okay, I think you need a little sulfur. I said, seriously? You're going to give me a little sulfur to take care of this open wound on my hand, and that's it? He says, yeah, that's what you need. And so sure enough, a week later, this thing that's been bugging me for 3 months is gone. And it was just a natural little boost that my body needed that wasn't the big guns. It was a little teeny thing. My chi was restored. My body said, we know how to take care of that. Thanks for the little boost. Now we got it. And I just, again, I know I sound like I'm hitting the same thing, but this is my life, and this is what I am very passionate about. All the research I've done backs this up. Okay, so we're going to introduce the sort of what I kind of talked about a little bit. There's a philosophy of what's called vitalism. And this may be something that you've never heard of, or maybe you have heard of it, but it goes to what's happening inside your body. I'll go back to the very first day that I was in undergrad school, and I saw my first cadaver, which I know that grosses out some people. But for me, it was a mind-blowing moment. It was like, oh my gosh, look at this body. Look at how amazing it is. And for me, it was the liver. I don't know. I'd never thought about the liver, but the liver is this huge thing. It actually is about that big. And I'd never even thought about my liver. I mean, I don't know. Jeff, do you think about your liver very often?
Not very often. Probably should more.
And then that blew me away. And then when I got to chiropractic school, the subject that blew me away was renal physiology, which is about kidneys. And I said, I never think about my kidneys. And that is happening all the time. All you people that are listening right now and will listen later, your heart is beating the right amount of times a minute for you. You're getting the right amount of breath per minute. The food that you had this morning or yesterday is being digested and turned into you. I mean, it just is a mind-boggling how amazing our bodies are. And that's what this vitalism is. It says that we are sustained by a vital force within us, that we have, our body is self-regulating, self-healing. If I got a cut on my hand, how quickly would my body start to heal it? The answer is immediately.
Immediately, yeah.
It might even know ahead of time. If I was around sharp objects, my body would already know, oh my gosh, Bill's around sharp objects. We need to do something to get ready. And it already knows that. And to prove that, I'll do a little thing. I did a workshop last night on nutrition to a bunch of teenage girls. That was interesting. Always interesting to talk to teenagers about nutrition. Anyway, and I said to them, when do you think you start to digest food? And I said, think right now, and I invite all you attendees to think about this, Jeff, you too. Think about your favorite food, whatever it is, could be anything. I'm a Maine guy, kind of like lobster, but I also like a lot of other things. And if you start to think about that, what starts to happen is you start to salivate in your mouth because your body is saying, yes, please give me some of that. I want some of that right now. So digestion starts in the thought process, and then for sure in the mouth way before it gets to your gut. The body knows if the food is good for you or not. The body knows if you had something really terrible, a bunch of fried stuff that you put in your body versus great holistic herbs and kale and veggies and fruits. Your body knows that, oh, great, here we go again. Bill just ate something terrible. We're going to have to deal with this. We have to increase the acid in the stomach. And that's what this whole philosophy of vitalism is all about.
For some reason, I want a warm bowl of clam chowder now.
There you go. Absolutely. I had some of that a couple of weekends ago. We were back in Maine, and we loved it. And so then the second part of this slide is universal intelligence. I do believe in God. You can call that whatever you want to, but I believe in God. I believe that there's a connection. I'm not a Big Bang Theory guy. I believe that it always planned. But anyway, regardless, there is a universal intelligence that connects to all of us. And that connects to us, and it is helping. It's not by chance that there's so much water on the earth. It's not by chance that we get so much rain, we get so much heat, we get so much cold. All of that all works together in this amazing synchronicity. Strange thought came into my mind. I've heard that one of the greatest professions in the world, other than chiropractic, is to be an orchestra conductor. Because you have all these people that are depending on you and you conduct them. And there's an amazing orchestral conduction going on in the world. And then that translates to inside our bodies, an innate intelligence inside there as well. And the more we listen to our body, the more we listen to what it's saying to us, the more we're going to be rewarded, the more we treat it right. I'll go back to my workshop last night. I talked about 6 keys to being healthy, and really quickly see if I can get all 6. One was nutrition, which is a huge deal. One was, actually, my wife just handed me the slip. Nice, just in case I was going to blow it. Getting blissful sleep. By the way, no sleeping on your stomach. This is a chiropractor telling you that. It's never going to be a good idea. Don't sleep on your stomach, side or back, absolutely. Hydration, drinking enough water. Half your body weight in ounces a day is about what you should have, including more if you do exercise and so forth. Nutrition, I already said. Exercise, you can't get away with not exercising. Now, maybe you right now can only walk a half a block or a couple of blocks, and that's the exercise you can get. Well, then do that. But beyond that, you need to push yourself. If you're not exercising at least 3 times a week, you're going in a downhill fashion. Breathing, any of the singers in the audience, you don't want to breathe out of your chest. You want to breathe out of your belly. And it's belly breathing, and it's breathing in deep and getting quality oxygenation. And then finally, the last one would be positive thinking and or stress management. And that all keys into this vitalism, because you can't say to your body, okay, I want to be healthy, and you've done nothing good for it in the past week, month, year, 10 years. If you're 50 to 100 pounds overweight, if you never drink water, all you ever drink is soda, if you have terrible relationships and you're not nice to other people and so forth, then you don't really, this may sound rude or strange or whatever, you can't ask your body to be totally healthy because you're not treating it the way you need to treat it. And that's all part of this vitalistic thinking. Okay, we're going to jump into sort of making a comparison between conventional Western medicine approach and holistic. And I know that I'm simplifying. I know that I'm stereotyping. That's like saying that all people from Italy are loud. I lived in Italy for 5 years. Most of them are, so I can say that up front. And I think most Italians would agree with that, but it's a stereotype. It's kind of like my big fat Greek wedding. Greeks and Italians are very similar. I was at a dinner one time with an Italian family, and they are yelling at each other. And the person next to me said, "What is going on?" They said, "Oh, this is normal. This is just the way this is the way we eat and we talk. It's great. Don't worry about it." Anyway, I diverge. Let's go back to this. So I know there's some amazing, wonderful conventional medical practitioners that don't fit these categories. And there's probably some holistic practitioners that could do a bit better on that side of things. But just looking at them, the difference overall is conventionally we're looking for a symptom. We're chasing a symptom. We're trying to get rid of whatever it is, whether it's a really serious one, including cancer, including whatever it might be, or it is something not life-threatening like a cold. The statement on a cold is that if you treat a cold with whatever you treat it with, it'll probably go away between 6 to 12 days. And if you do nothing but natural, nice things to your body, getting rest and so forth, it'll probably go away in 6 to 12 days. And the cold isn't the end of the world anyway. I'm going to diverge again. The flu, I have to say something about the flu. The stats really are not that tens of thousands or hundreds of thousands of people are dying from the flu every year. It's the side effect like a pneumonia that actually can kill you. But the flu itself is very few, like a dozen in the United States, dozen to 2 dozen a year. You can look this up and check my stats. I promise this is true. But then we freak out about the flu. Have I had the flu in the past? Yeah. Did I love it? No, I didn't love it. But the body, it's part of the process of letting the body heal itself. This is actually from an MD in New York City. His name is Dr. Lawrence Palevsky. Good Polish-sounding name. And I'm going to read you a little quote from his website. You can look it up, Dr. Palevsky. And he actually said, he feels that we are harming children with the constant use of over-the-counter medications, antibiotics, drugs, and vaccines that treat and suppress common and necessary childhood symptoms and illnesses. Okay, we just took a jump into light speed here. I am actually telling you, yes, I am, and so is Dr. Palevsky, and so is a whole bunch of people, that getting sick is actually not a bad thing, that actually getting a symptom and overcoming it is actually something that helps the body get tougher and stronger. Getting a little dirt in your kid's life isn't the end of the world, because dirt is actually not a bad thing. If you think about it, where is the most common place to get a staph infection? I don't know if this is 100%, but in my experience it is. It's at a hospital, which is squeaky clean, and there's no dirt anywhere, and the body's kind of saying, okay, give me a little dirt here. This is too clean, and you get a staph infection. I jumped to it. So anyway, if you look at this, you see that, let's go to the middle one. Health is the absence of illness or disease, meaning that if you don't feel sick, you must be healthy. On the other hand, total health, wellness is more of a dynamic thing. It's more of I have a friend who is a lawyer back in the state of Maine. His office is right next to me. He never, ever had any strong symptoms. He probably knew that he was overweight, wasn't exercising enough, etc. But he never had a heart attack until the fatal heart attack. He literally is at his office, next to my office one day. He's in his mid-50s. He puts his head down on his desk, and he dies of a heart attack. Well, was that individual, we'll call him Joe, was he healthy before that? Well, no. Did he have major symptoms? Not overt ones, other than things that he probably knew he could do better. So
we have a question, kind of, you've alluded to this a little bit, but what recommendations do you have, especially obviously within pediatrics, of the use of vaccinations?
Okay, that can be a whole entire conversation, and I think it's, for me, I've done workshops on vaccinations probably for 30 years. In fact, I'll tell you where I started. So my oldest daughter is 38. I know it's hard to believe that I could be that old, but it is true. And I started chiropractic school about 40 years ago. I'm not even at school yet. I'm just going to church the first day before classes start. And in the middle of a conversation between adults in my church, there's this explosion. It's like a bunch of Italians, and they didn't look Italian, and they're yelling at each other. And I said, what is going on? They said, well, you should know, you're going to be a chiropractor, right? I said, yeah. So they're talking about vaccinations. And this is the honest truth. I'm 20-something years old. I said, what's the controversy with vaccinations? I didn't know. I didn't have any children. I had gotten the vaccinations growing up as a kid, because that's what my parents did, and that's what happened to me. I had gone on a mission for my church over to Italy, actually. I got a bunch of vaccines, and then I felt pretty crappy after that. But I'd never investigated, and I said, okay, we're going to have kids at some point. I got to dive into this. So before that, I was the person that was uninformed, didn't know there was any controversy, didn't know there were two sides to the story or many sides to it. And so I said, okay, time to dive in. Since that time, for me, it's a risk-benefit thing. Is it a greater risk to have the vaccination with the stuff in it versus the benefit of getting it, or is it a greater risk of not getting the vaccination and the benefit of trusting your body? And if you kind of got a feel for where I'm at, my take is that in the United States anyway, now if I lived in Zimbabwe, if I lived in Peru, if I lived in Sri Lanka, I might have a different approach, because my understanding, and this is very well backed up by lots of studies, the major dive in vaccination and the diseases for which we vaccinate occurred before mass vaccination started. And it was largely due to better sewer, better water, better health practices within our lives and in our society, so that now all that stuff went away. I've been to Africa a couple of times, to the country of Zambia, and they have cholera outbreaks every year when they have the rainy season, because their sanitation is not good. Their water is not good, and they don't take care of it. So there's this breeding ground for cholera that, if you are unfortunate enough to not live in a good home, having water supply and adequate toiletries and so forth, then you're really very likely to get cholera because it's there. So my take on vaccination, and I would invite all the people watching this either now or later, is to dive in and find out what you think. My evidence, based on all these now 40 years of looking into it, is that if I could naturally give Jeff and we used to do this. We used to have chicken pox parties. I don't know if anybody else has ever heard of them.
Everyone's stuck on the lollipop, right? Pass it around.
Even not that overt, but anyway, just being in contact. And I did that as a kid. I remember I got my first chicken pox on my tummy. I looked down and I was at a friend's house. I said, oh, something was weird. And the mom said, oh, no big deal. Actually, hang out with my kid for a little while so he can get it too. And then with our kids, we did the same thing. So if I can naturally give you that, that's awesome. That is a natural way to pass on immunity. My challenge is the stuff, I was going to say the word crap, I just did, that is inside the vaccinations that includes mercury and aluminum and formaldehyde and human fetus tissue and all kinds of stuff that I would not opt to say, yeah, give me some, I'd like a little mercury in my life, or to my kid that's 2 months old. So there we go. That's my vaccination thing. I could go for way longer on that, but I feel very strongly about that, but it's because it's very personal to me. I had to make decisions for my own kids, and I make recommendations for my children, my grandchildren as well. So it's a very dear, but I think it gets right to the heart of this discussion. I think it's the discussion of, is there a way to trust our body more, or do we have to trust medicine more? Kind of like, are we born to be healthy, or are we born to be sick? And I definitely believe we were born to be healthy. That brand new little baby, any of you that are parents or grandparents and you've seen that baby that very first time, in fact, I'm probably going to get emotional. 38 years ago, our first daughter came in our life, and I was blown away at how beautiful she was, how miraculous this was, and how she didn't need anything else. Back in those days, they wanted the silver nitrate around the eyes to treat gonorrhea. I said, look, you want to test my wife for gonorrhea? Go ahead. She doesn't have it, and we're not getting the silver nitrate thing because she doesn't need that. My little girl does not need to have that put in her eyes. A lot of side effects to that too. So anyway, I just thought I'd do a quick take back story. You can tell I love kids. I hang out with them all day long. 40% of my practice are kids 10 years and younger, and I'd say probably about 10% of that are babies. And this is a cute little family. They told me I could use their pictures. And I'm talking to one kid, and he's eating some of my snacks, and he's got toys in his hand, and the other kid's looking at the camera. I love this picture. When I was 21 years old, my sister's working for a chiropractor. Didn't even know what chiropractor was. Never really heard of it. I grew up in Maine. We didn't know a lot of things in Maine. Anyway, so she said, oh my gosh, Bill, you're going to be a chiropractor. This is going to be awesome. This is going to be fantastic. And I said, I don't even know what that means. She said, well, just come to a workshop. He's going to do a workshop, and it's going to be, it's going to be great. I figured it would be on low back pain. It would be on neck pain. It would be on car accidents. And it was on kids. He worked on with his hands very naturally in a gentle way on a baby with colic. Baby seemed happier afterwards. 2-year-old with ear infection. 2-year-old kind of liked it too. He did the drainage thing I talked about, did some other stuff. Kid liked it. Parents liked it. Then he worked on a 10-year-old, some digestive stuff. And I said, wow, I have no idea what he just did, but the kids liked it. There were no drugs involved. There's no blood involved. Nobody threw up. I don't like blood. I don't like throw up. Not that anybody does, I guess. And that was it. That was a life-changing moment in my life. I said, going back to undergrad, I'm going to change my major. Then I'm going to go off to chiropractic school. And that's where it all began. At a moment like this, looking at a little kid. So for me, I don't know that I want to just say a strong word that I'm a defender of kids, but I feel a lot worse for a baby or a 2-year-old or a 5-year-old that has a bunch of symptoms because they generally don't deserve it. They didn't do 30 years of bad eating, bad drinking, bad whatever to get there. They just have these pure little bodies, and it is amazing how you can just almost flip a switch and poof, all of a sudden the body says, oh, that's what I needed. Thank you very much. And then it heals itself. Okay, so the next couple of slides are going to be a little more practical about, okay, what do we do? What do we do as a parent? What do we do as a grandparent? So I've already said a whole bunch of stuff about how to help your kid be healthy. No, you can't just have chicken nuggets and soda and French fries and let me see what else would be terrible, all those kinds of things. Actually, a funny story, my daughter is a very, very fit. I have 3 daughters, and one of them is uber fit. She's done fitness competitions and won them. And at one point, she was eating like incredibly healthy, and she was living at our house, and her 7-year-old daughter at the time was there. She was giving her this terrible, crappy cereal with sugar. And I said, what are you doing? I said, you're eating incredible. You can't do that to your kid. And she said, yeah, you're right. Anyway, but it was easy. It was quick. So how do you make a decision? Your child is in a panic situation. There's a healthcare crisis. How do you know when to go to the ER, Instacare? How do you know when to go to your family medical doctor? When do you go to your family chiropractor? When to do nothing but observe, comfort, love your child? These are tough choices. I'd say the more in tune you are with your child, and I have 6 kids. One of them complained all the time. That person may watch this later, and that person will know who she is. That's a she. I had another child who was tougher than nails. He actually pulled his teeth out. When the tooth got loose, he'd pull it out with pliers. Well, I'm going to treat those 2 kids differently. I know that the one child may be crying wolf, if you know that Aesop fable, and may not be in a death situation. And the other kid, if he says that he's in pain at all, I'm jumping. I'm saying he's probably had this forever. In fact, true story, he had the only ear infection of any of my kids, my 6 kids, over that near 100-year period of time between 0 to 18 years, remember that? And I looked in his ear, and it is red hot, and I felt terrible. I said to him, he'll won't mind me saying, his name is Matty. I said, Matty, why didn't you tell me? He said, well, I thought it was going to go away. It wasn't a big deal. He said, what's going on? I said, you got a full-blown ear inflammation. You got an infection. It looks terrible. I said, what do you want me to do? He says, well, just do your thing, Dad. You know your thing. You just do that. Do the little thing there, drain it, do an adjustment. We said a little prayer. We did some other things. I did some natural treatment. It was at midnight, and so we did our own garlic and olive oil treatment, which, by the way, it's better to get the drops at the store because the garlic you have at home smells way stronger. His whole room stunk after that of garlic. But the next morning, I looked in his ear again. Was totally white. So which of all those things helped? I don't know. But in that case, I was ready to panic because it was the kid that has a way high pain threshold. So I was ready to do something else. And he said, no, Dad, just, this is fine. It's going to be fine. We're just going to do the normal stuff. So there are times to go to the MD. If a kid has bronchitis to pneumonia, that's a no mess around time. The holistic approach may have to wait then. Things short of that, you can probably wait and observe. You can probably do some easy things. If you have some essential oil treatments, if you have some natural herbs, some things you can do to yourself. The family chiropractor is going to do a more conservative approach than going to the ER or to the family doctor. They're going to want to give you something. I had a very good friend, pediatrician back in Maine. He said, Bill, you have a major advantage over me. You can't give out drugs. And I said, well, I don't understand. What do you mean? He said, well, sometimes parents will come to me, they'll have an ear infection, but I know it's actually just an inflammation, and they want to freak out. And I want to say, no, I don't want to give you an antibiotic. Just trust your body. He said, some parents will do that, and some parents said, no, I have to be, and I'm going to jump over the line here. In order to be a good parent, I have to do something. And that's what I'm encouraging you not to do. I'm encouraging you to not over panic. These are tough choices, though. And you have to be in touch with yourself, with your kids, and be very much in the moment to know which of those things you need to do. We chiropractors, pediatric chiropractors, there is a difference. You should look up in the ICPA directory, ICPA, 4, kids.com. That is the website to find a pediatric chiropractor throughout the world. And we do have different training. I'm very keyed into what's happening to, I had a 1-week-old come in last week. I had a 4-week-old come in last week. I have little babies all the time. I have older kids as well. How can I help that nervous system? That's the discussion that I have with myself and with the parent and with the child. I'm going to show you a little chart that I have. I don't know how well you can see this, but it just shows that the body's connected. Crooked there. Autonomic nervous system, how the brain is connected to the different organs of the body. Whether you knew this scientifically, you knew this. You know that if your brain and your nervous system is not connected to your stomach, then it ain't working. And anyway, so this is, but that's what I show to every parent and child that come in. That's what we try to do to help their nervous system work better. Very briefly, what can happen to the spine is you can get a mislaminar subluxation. And when can that start? Well, actually, it can even start pre-birth, in utero. Parents know that if they have a breech child, they are much more likely to have a scoliosis, hip joint issues, and general health problems because that's not the way the baby was supposed to be. But then baby being born under the very best of circumstances is a pretty dang tough thing. People always say how big babies are, and I always say, that looks huge because that just came out of his or her mom. That's a big thing coming out of mom. And that's not easy to do. That's why the cranium is has the soft spots here and back in there. And they may or may not have my hair pattern. And so the cranium actually folds on top of itself to be able to come out of the vaginal canal. Vaginal birth is way better than a C-section because that's where a huge dose of immunity is processed as the baby goes through the vaginal canal that does not occur in a C-section. I could talk about this forever. How often does your toddler fall? I'll ask parents that sometime. I'll say, so just give me a general estimate. How many times has Susie fallen today? Oh my gosh, I have no idea. I have a family of 5 that come in, and there's my hand right there, 5. And the number 4 kid is the one that used to headbutt his siblings and everybody else. He was the most subluxated of all the other ones. He had older siblings that were not nearly as subluxated because headbutting is not a good way to show your frustration or your joy or anything else. So anyway, a quick summary again. You're going to have, if kids fall, they do all kinds of things. They can have stress in their life. That can definitely affect them. So I just have a general approach of pediatric dentists have done a great job of educating people to get checked whether they have symptoms or not. I would recommend the same thing. This isn't the only way to help your child be healthy. This is a part of the overall thing. If you do a Western medicine approach, then you're going to wait till you get a symptom. If you do a vitalistic wellness approach, then you're going to go before that and say, hey, I wonder if my child has a subluxation and if that could help him or her out. So I do have some handouts that I'll make available of how to boost your immune system, how to help it in a natural way, and then also some natural remedies. Anyone that's interested in a handout, I have some natural remedies that if you do get a cold, this is a way to treat that. If you do have upset stomach, if you have diarrhea, if you have constipation, some natural remedies, I'll have that as well as a possible that you can have. If anyone wants that, just let us know through the ZYTO process and I will get that to you, or go to my website directly. So here it is. This is my family. If you do a quick count, this is a picture before the right number of kids, but not the right number of grandkids. So since then we grew a little bit, but we were able to raise a fun, happy family. Did my kids never get sick? No. But if they did, we didn't freak out. And I guess that's my parting advice to you is don't freak out. Trust the body. Now, if some terrible things happen, I will say one quick thing. 24 hours to 48 hours after a significant physical trauma, your body or your child's body probably will, in fact, react. It probably will say, ooh, something just happened to me. I need to do something about that. Don't freak out about it. Kind of be in touch with that and say, let's just chill a little bit. Let's just see what we can do to help the body function better now. Jimmy or Susie did have a trauma, and then help to be as calm as you can be and do things. If you have to do something drastic, then do something drastic. But we found that we didn't have to do things drastic very often, and that instead we could be calm and relaxed and chill, and the body heal itself. So there's my website. I invite people to go ahead and visit that. There's a way to communicate with me that way. I am not alone in thinking this way. There are many, many people that share my thinking, that are practitioners, that are moms and dads, and those are the people that I'm reaching out to. People that say, oh my gosh, this sounds really weird. He doesn't want me to take drugs. This has got to be the strangest thing I've ever heard. Yeah, maybe that person isn't ready to jump into a more vitalistic or holistic life, and that's fine. We all have our when we're ready, when the student is ready, the teacher will appear. And I hope for some of you today and those that will listen later online, that this might be a moment that you're willing to take a deeper dive into more holistic thinking.
That is awesome, and I thank you so much. What a great presentation. The more we kind of learn and we share this expertise with each other, I mean, we have, just with you, 40 years of experience, and then you combine that with everyone else that's listening, and we share this information around, it's so valuable. Because that's really ultimately how we find solutions to problems that have occurred through decisions of other people that maybe didn't have that same expertise or were willing to try out different things, and that's what is so great about this. We have a lot of questions that have come in, so we've been kind of pouring through all of them. I'm going to get to as many as possible. If I don't get to them, for people that are attending live, if we don't get to them, we'll do our best to get these over to Bill and see if he can reach out and maybe answer as many of those as possible as well. But from your perspective, like what are some of the main reasons that you see kids coming into your practice?
So yeah, we skipped that slide. That's okay. Colic is number one for babies. They come in, they're very uncomfortable, and it's because their sympathetic part of the nervous system, if you don't know what this means, look it up. It's the fight or flight part of the body. It's cranked up. For me, a colicky kid almost wants to be back inside of mom because it was quiet in there. It was dark in there. It was controlled. It wasn't all this sensation, all these sensory inputs like, ah! So we help to calm down their little bodies doing a parasympathetic stimulation, craniosacral. I do see a lot of kids for reflux, for constipation, very uncomfortable, ear infections, sinus things. I had a woman bring in a daughter recently for headaches, for allergies, for any kind of symptom you can think of that most kids have growing up. That's why they come in.
Okay. I have a 9-month-old that I need to bring into you. So what do you, in lieu with what you do with chiropractic work, what's your thoughts or viewpoints on pediatric, like acupuncture work?
I think that's great. I think acupuncture's been around probably longer than any other health profession that I know of. And I love it because it treats the body, the high energy, the yin and the yang, and it treats the chi in a natural way, helps the body heal itself. I've used acupuncture. I think it's great. Awesome.
And Dr. Cook, the founder and CEO of ZYTO, he's actually an Oriental medical doctor. He's an acupuncturist by trade. And so a lot of those theologies and practices are built within ZYTO technology. So a lot of that information.
And I actually knew that Dr. Cook was that, but that's not why I gave that answer.
No, I know. I'm just, it's awesome. I mean, acupuncture provides a lot of really great details as far as the correlations between, stress responses within the body. Even though there may be digestional stress, it may be correlated to other areas of the body. I mean, you mentioned that with, the chiropractic. It could be a vertebra being out of alignment or whatever that is. But do you use essential oils or anything like that, supplements in your practice?
Yes. I don't sell them. I recommend them. So I actually have people that I recommend they go see. And I have some people that come into my office that are essential oil practitioners, and I will ask them questions. I don't pretend to know everything. And I'll actually give them a scenario, and I say, would you mind if this parent calls you up and contacts you? I think they're great. We have in the other room, we have right now a little, what's it called? The thing that mists in the air.
Oh, yeah, diffuser.
Thank you. We have it going on right now, and we have different oils that we use based on how our moods are or how people come in. We do that as well.
That's awesome. Yeah, we have those running in our office all the time. It hopefully helps settle and keep everyone in with great chi, right? So I think we have a couple more. We're going to probably pass those over because we are out of time for today's webinar. I want to personally thank Bill for your time and putting this together and taking time out of your busy schedule to be with us today. I hope everyone, it's been awesome. We hope that today's event was enjoyable. It was for me. I learned a lot. I'm sitting over here taking a ton of notes, and I know that I have a lot that I'll be sharing with my wife tonight as far as information that we can hopefully raise a healthy children. Thank you again, Dr. Bill. Our next wellness webinar will be in 1 month. We had some scheduling conflicts and have had to rearrange, so we don't have our presenter ready for next month, but we are going to be having it at the same time, 10 a.m. Mountain Standard Time on Wednesday, September 5th. I would encourage you to at least register to be notified of once we have some of that information. The registration links will be sent out to all the people that have registered for this webinar. Share it and get people involved with it. We look at this as an educational opportunity, once again, bringing back to the community and sharing ideas and concepts. And I mean, here we just were profoundly fed from, Bill of experience and his perspective on wellness. And so that's what we're striving to do with this wellness webinar series. We hope you can share it and get more people involved with our community. We'd like to thank you for attending live. If you're watching this after the fact, we hope that we can get you next time. If you want to learn more about ZYTO Technologies, we'd encourage you to go to ZYTO.com. On a weekly basis, we have a blog on there that has a tremendous amount of content that's being produced, high quality with different perspectives. Dr. Cook will be adding to it. We have other collaborators on that blog as well. So this is kind of an ongoing thing that you're going to be seeing from us, and we'd encourage you to engage with us there. But until next time, we appreciate your time today, and we'll see you in a month. Thanks.